So, um, you know, it's a ever evolving industry, and you have, 25% of the population is immunocompromised, and then there's different levels of that where people's lives are just devastated. There's you know, you have people that are allergic to mold and allergic to things, and you can go to the allergy doctor and they can dial that in and get you on an antidote. And then, the next level, when it's bloodborne, and you get what is now via Dr. Schumacher called Chronic Inflammatory Response Syndrome, which we have a CIRS section on my website at nwamoldinspector.com. And that is a medical diagnosis, CIRS, CIRS, Chronic Inflammatory Response Syndrome, that they can now identify with a brain scan. And they say that people that are affected with CIRS brain scans look real similar to football players, but they can differentiate the difference between CIRS and Alzheimer's and all of the brain diseases, Parkinson's, all of those things that they use that for. So the diagnosis are getting there. It's someday probably, if we're lucky and the research is done properly and the field work is documented properly, in another decade, maybe this moves more toward where we're in the healthcare business. Have the ability for people to file insurance claims on their homes being, affected with a debris field of stuff that's left behind even after a remediation company comes in and does the remediation, and it's all clear and everybody thinks it's fine, but what's left behind is a debris field that'll affect people until it's cleaned, which could be forever, uh, because the tests to identify that are, it would be $1,800 minimum to do the 3 or 4 tests that are needed to identify that. So, that's a tough pill for most to swallow. So that's kind of the ins and outs of the quick look at the indoor environmental hygiene side of what I do.